assume that you're seeing me now. I'm looking on my cell phone too. And okay, so I don't like where I'm at on the screen. I'm kind of blocking some of the stuff here right now. But um, if I knew how to move my head, but I don't. Okay, so whatever. All right, here we go. All right. So what we're going to talk about, and then we'll do a Q&A at the end, the statin lie. Let's jump right into it. I promise you I'm a much better cardiologist than I am a technician here. Statin drugs are the biggest selling class of drugs of all time. Statin drugs are the biggest selling class of pharmaceuticals of all time. And it has been tremendously profitable for mainstream pharmaceutical companies. Now, what have we gotten, though, for that? Have we gotten longevity? Cardiovascular disease is still the number one killer in the world. Okay, it's still the number one killer in the world. This is from data from the American Heart Association 2025. So, despite all of the hundreds of billions of dollars, all the statin drugs, all the angioplasties, all the stents, all of the defibrillators and pacemakers, all the fancy stuff that we do, the CT scans, it's still the number one killer around the world, despite all of these pharmaceuticals. And I'm going to share with you the reasons why. You know, if you take a statin drug, you don't get an award for low cholesterol. No, that's not why you're taking a statin drug. You want to know, if I take a statin drug, is it lowering my risk of having a heart attack, stroke, and dying? And I will tell you that the answer really is no. And I'm going to tell that to you right now. And I'm going to give you some strategies in just a couple minutes that are really going to help you with the lowering of cardiac events. I'm going to tell you all about that. But remember, you don't get any awards for this. And I know that's kind of tongue in cheek, but you want to know, again, if I'm going to do any kind of procedure, what are the benefits, what are the risks, and what are the alternatives? And you need to ask your doctor that. Remember, this is a partnership. This is not a dictatorship. You need to have these conversations with your doctor. And somebody should be there with you also, because sometimes this one-on-one, if you can get someone in the room with you, a friend or a family member, or even just to record the interaction. So you remember, hey, doctor, do you mind if I video this? Why would anybody mind that? I've done thousands of consultations. I record them on Zoom. And I send them to people. I'm not afraid of anything. I want you to have the information so you can remember what was said. So, again, please make sure that there's emergencies, but then all these other things, we really want to get the information. Okay, I understand that statin drugs will lower my numbers down, but what does that mean? What does that mean? Now, I'm going to tell you that statin drugs fail for these 4 reasons. Number 1, they don't work to meaningfully lower your risk of heart attack, stroke, and dying. So let me state my case here further. Number 2, they do have tremendous side effects. Now, maybe a third eyeball, maybe that's not one of the side effects. But the side effects of statin drugs lead you to muscle aches, muscle pains, liver issues. Many people have suffered brain issues from it. There is loss of libido, hormonal changes, digestive changes, lack of energy from it. All different types, obviously elevated blood sugar, osteoporosis, all different side effects. Number 3, they provide a false sense of security. I can pop a Lipitor and eat whatever I want. And that is not the case. Remember, as a quick interlude here, people, I'm Dr. Jack Wolfson. If you like this information, go ahead and subscribe to my channel. Go ahead and share this video with people who you know and love, because you just may save their life. Number 4, they keep you plugged into the system. They keep you plugged into the system. So you're constantly going back to the doctor for checkups. You're in and out of the pharmacy. You're in that medical matrix. What does it mean, almost as like a post-traumatic stress, to be labeled with high cholesterol? That's very stressful, and stress is not good for your health. What does it mean to take a pharmaceutical? I need to take this drug. I was told I have high cholesterol. You don't have anything. You have been told something, and you have been maybe given a warning, but now we got to do something about it. Do not accept ownership of a medical diagnosis, people. Do not. I don't have high blood pressure. You don't have high blood pressure. You may have been told that your blood pressure is high on several occasions, and you've been told to take a pharmaceutical. But don't own that illness. It's very important. Don't own it. I don't have arthritis. I don't have dementia. I don't have weakness. At this time, my thinking isn't as clear. At this time, I feel weak. At this time, but it's going to get better, and it can get better. Don't own those things. A little bit about me. I am a cardiologist. Been a cardiologist since I graduated in 2002. I was a former partner at the Arizona's largest cardiology group, hospital-based cardiologist, chairman of medicine, director of cardiac rehab, Phoenix top doc in 2011 by my peers, international speaker, my beautiful bride, Dr. Heather, and our 4 children. I'm also an Amazon best-selling author. We've got hundreds of thousands of people who follow this information over here. It should be 10 times that, should be 100 times that as we get the information out there for health and wellness to the world. Here's what Danielle said. I was able to come off my cardiac medication, leaving behind the side effects and improving my heart function. Okay, now I want you to really see this here, people. I want you to see this. Really important. Statin users live 3 days longer. You may have heard other cardiologists say this. Not many of us, but you may have heard other cardiologists, other doctors say this. And why do we say this? It's because this is what was shown most recently, 2022, in the British Medical Journal, and this was also evident in the New England Journal of Medicine. They looked at 21 statin trials, and survival benefit, meaning who lives and who dies, the median survival gain, you get an extra 3 days. Extra 3 days on statin drugs when used for primary prevention, meaning you've not had a heart attack or stroke. You get some more extra days when you've had a history of heart attack and stroke. Do you really want to take, do you want that false sense of security for 3 extra days? Go research it, go Google it, go look it up yourself. My intention here really is I'm an attorney for natural medicine. There's an attorney over here for pharmaceutical medicine. And us attorneys state our case to you. You're the judge, you're the jury. You decide. This is a partnership. You decide what's right for you. I'm a car dealership. I'm selling one car. This car dealership's selling another car. We each present our case to you, and then you decide which car you want to buy, or maybe you don't buy either car. Maybe you go looking for a third car after hearing us. 2015, no significant effect on overall mortality. So don't tell me that the statin drugs are meaningfully saving lives, especially for primary prevention. I know you've heard other, but again, go look at the British Medical Journal. It's one of the biggest medical journals in the world, where they look at 21 trials. And this is what they come up with, 3 days. Now, what if the results were even better for statin drugs? What if it said you live an extra 30 days on average? Would that excite you? An extra 3 years may excite you, but an extra 30 days in order to suffer all the side effects? And ultimately, it's not about how do we get you to live a few more days. It's how do we get you to live an extra 5,000 days? Wouldn't that be nice? An extra 15 years? I'll sign up for that. I'll take that. Cochrane review. Huge analysis here. No clear extension of overall lifespan. Okay. Now, this is really important as well. This is the All Hat trial, All Hat LLC 2017. What they found here is that statin drug versus placebo in people older than 65, actually 65 and older, 18% more people died in the statin group. And if you were 75 and older, 34% more people died in the statin group. All Hat LLC. This is why I say what I say. This is why I'm so emphatic, because people are dying every single day because of the statin drug failure. Yet it's the #1 selling drug of all time. Why would it be the #1 selling drug of all time when you see data like this? Now, here's the scary thing. Statins inhibit the production of cholesterol, which cholesterol you need, your brain needs, your heart needs. Every single one of our trillions of cells is surrounded by a fence called a cell membrane. The brains of the cell decides what gets in, what gets out. The fence is made up of cholesterol for a reason. Vitamin D comes from cholesterol. The sun hits the skin, turns cholesterol into vitamin D. We need cholesterol. Cholesterol is critical for our digestion, our hormones, testosterone. Get your attention, men. Estrogen, progesterone, and testosterone. Get your attention, women. Very important stuff. Aldosterone, cortisol, aldosterone. When you take a statin drug, you inhibit the production of CoQ10. Cellular energy, big problem. Dolichol, centered in the brain, big problem. I believe that's what leads to statins increasing the risk of Parkinson's. Heme A, again, electron transport chain, cellular energy, how cells turn oxygen and food into energy, or currency, to get the stuff done in the body called ATP. Vitamin K function, which is why you have increased coronary calcification on statin drugs, which is why osteoporosis and fracture risk is increased on statin drugs. Now, ideally, what we want is not lower numbers. We want to live better. We want to live longer. We want to live more fruitful. That's what we want. We want to live better lives. And that's what we do here at Natural Heart Doctor, the home for the 100-year heart. We want to be dancing at a wedding. We want to be traveling around the world. We want to be mountain biking. We want to be hiking and active. It's up to you, people. Inside the mainstream medical world, you live until 76 as a man and 79 as a woman. And the last 10 to 15 years of those are in and out of the doctor's office. That's not living. That's dying. That's dying. So do you want to be the person like this couple here who's dancing at the wedding? Or do you want to be the person at the wedding who's in a wheelchair and being pushed around by family members who nobody really wants to talk to? I want to talk to this couple on the screen. I'm not quite as excited about talking to the person who's sick. It's just human nature. So, and I've talked to plenty of sick people in my career, that's for sure. And it's just sad because we know when I'm talking to someone like that, I know I could provide so much more by listening. God has put me here for this reason, people. If I had one superpower, it would be to get this message in front of millions and millions and billions of people. That would be my request for the superpower. Okay. So, time to toss the statins. Caveat, I'm not telling you to stop any pharmaceutical. Ask your doctor. Unfortunately, they're the one who prescribed it, so they're probably going to tell you to take it. You may want to get a second opinion. You can get a second opinion from us at Natural Heart Doctor. When I talk to people, I tell them to throw the statin drug in the trash and stop cold turkey. But that's me. That's what I tell my patients. You're not my patient, so you have to do what's right for you. But again, no one's forcing you to do anything. You are free to take something or not take something. Remember that. So this is our methodology here, the 100-year heart. Okay, this is what we do over here, the 100-year heart. The 100-year heart method. We got Thrival Nutrition, Thrival Lifestyle, Thrival Biohacking, and Thrival Ultra Diagnostics. Thrival Nutrition is about what to eat, what not to eat. Thrival Lifestyle is about how to live healthy in this world and how to avoid unhealthy things in this world. Thrival Biohacking is evidence-based supplements and other strategies, and that may be sauna, red light, and many, many others. I'm going to speak at the world's biggest biohacking conference in the world in Las Vegas coming up next weekend. And then Thrival Ultra Diagnostics, doing the most advanced testing in the world to determine what someone's risk is. So I don't want you to worry about cholesterol levels. Well, what's good cholesterol? Is it 160, 260? Is it 200? My doctor said get it under 100. My doctor said get it down to 0. What we want is to find the perfect cholesterol levels for you to get the job done. Because remember, cholesterol does all these things for the brain, for the heart, for all of our cells, all of our hormones, all of our vitamin D. It's there for a reason. Why do all animals have cholesterol? Why do all animals have LDL? These serve a purpose and they're not bad. They can be damaged. They can become what's oxidized, and the oxidation process is what's bad. Now, oxidative stress is what you see on the screen here, where you take an apple and you cut it and it starts to brown. Same thing happens to an avocado. Same thing happens, everything starts to oxidize. That's why when you open up a bottle of olive oil, you want to use it quickly. That's why my Cardiology coffee, I will never sell a ground bean product, because as soon as you grind it, it starts to oxidize. I want to use whole bean. And when you open up that coffee bag, it's ours is obviously nitrogen purge, and it's got that, it's got the zipper on there to reseal it. But you want to use a coffee bag within like 2 to 3 weeks. Which is not a problem in my house, because I typically go, through 3 to 4 cups of coffee per day. My wife has a cup of coffee per day along with her raw cream. So we want to measure oxidative stress, though. We can measure oxidative stress. And again, this is what happens. You take a cell, and as the cell starts to have a lot of free radical damage, this is what we identify as oxidative stress. You've all heard of antioxidants like vitamin C, etc. And those things help to balance. So we want to, there are natural forces that happen that are pro-oxidative, that's okay. And we balance it with oxidation or antioxidants. But when that balance is out of alignment, we're in trouble. So we can tell that. And the causes of oxidative stress, and I'll tell you about how to get tested, but mold mycotoxins, bisphenol A, phthalates, pesticides, GMOs, air pollution. The list here is very long. The oxidized cooking oils, rancid seed oils, toxic metals, mercury, lead, arsenic, cadmium, stuff like that, thallium, thorium, barium, gadolinium. So all those lead to excess oxidative stress, and we want to make sure that we reduce the burden of those and get more of the good stuff. So this is the test results here from a home test kit that we send out from a company called Genova Diagnostics. And maybe my team can put this in here, the link to this. It's called the heartattackrisktest.com, which is actually this link here, heartattackrisktest.com. So you can hyperlink that and you can check that out. And what it is, it's a home test kit. So we send you the test kit, you collect a urine sample, you put it back into the container, you send it to the company, Genova Diagnostics. They are a CLIA certified, HIPAA approved company who's been around for, I think, over 40 years in business. And they're one of the world leaders in health testing like this. And this is a good way at home test. And it includes a review with one of the team members over here at Natural Heart Doctor. And what you can do is you can check yourself at time 0. We come up with a new plan based on the review. and then see where you're at down the road. It's a really good assessment and so much better than total cholesterol. Total cholesterol is a worthless marker. Worthless marker. I check it. It's included in the panels because it's included, and people invariably want to know, but it's not something I even pay attention to. Now, we know from the Framingham study back in the 1970s, the sweet spot of total cholesterol is 160 to 260, but that's a big range. And is 260 best for you? Is 160 best for you? I don't know. What we do is we implement the 100-year heart method, and then we get the metric. We get this kind of testing, and this is a perfect standalone, no order, no doctor necessary, done at home, no blood draw type of thing. So that's called the heart attack risk test. All right. Now, if you're interested also in a deep dive into the natural heart doctor method as it relates to cholesterol, on the website, we've got this cholesterol masterclass, natural solutions. We've got 92 reviews on it. Hundreds and hundreds of people have taken it. It's only $45, money back guarantee. But I want to do something special. If you want to use the code LIVE25, I'll give you 25% off the price on this particular test. LIVE25 on this particular test, and and use that code. Okay, so now I will end the share screen, and I will be happy to answer any questions that people have. I'm going into the live chat area. So my team put that up. Follow the 7-day plan as well. Yep. Statins bring down the good cholesterol and the good cholesterol. Yep. It's like an antibiotic killing good bacteria. Yep. Totally true. Totally true. Maybe one of my team members check and make sure that that code is valid. Guys, if you're liking this, give me a thumbs up here. There should be a button on your screen to give me a thumbs up. Are you liking the presentation? I love talking, obviously. Ask your questions here. Happy to go over anything. Do you know vitamin E works like a statin? No, it doesn't. Vitamin E is a good antioxidant, but I don't recommend it in supplement form. I recommend getting it from the food. So can you tell me about Optilipid? Optilipid is 7 different ingredients, optilipid.com. I created this product. I have it made for me by Biotics Research, 2 brothers in business, 50 years. They've been selling to doctors. I spoke at their event. They had 750 practitioners in the room. So what's Optilipid? It's 7 different nutraceuticals I pulled from the medical literature. So yes, everything is evidence-based, and it's all in there. Optilipid. Optilipid it doesn't shut down HMG-CoA reductase like a statin does. What it does is that it improves hepatic clearance of LDL particles. Because what happens is, as we get older, as we have all these different toxins, the LDL does not get cleared out of the body. So we want to improve our liver health, which is what this product does, in order to clear old LDL particles. Now, it is also evidence-based to lower inflammation, lower oxidative stress, lower blood sugar, and then also can lower blood pressure. Now, probably the most impactful nutrient in there is berberine, B-E-R-B-E-R-I-N-E. Almost 10,000 studies in PubMed on berberine. It is a wonderful, wonderful product. Wonderful product. Okay. If you can, people, go ahead and subscribe, to my page, please. If you again, give another thumbs up in there. Thumbs up on this presentation is always very good. Again, Optilipid, there's a lot of information on the website, optilipid.com. My team posted it there. The LIVE25 code is working, so we're offering a little bit of a discount to get into the masterclass, and you'll have access to the masterclass immediately. Okay, what about algae-based omegas, Robert? I like omegas from seafood. I like eating seafood. Seafood is the single best food that there is. Seafood is seafood. It's good for your eyes. It's good for your brain. It's good for your heart. Seafood eaters live longest, live best. People with the highest levels of omega-3 fatty acids live the longest, live the best. I have an omega-3 fatty acid test kit around here too. That I was going to maybe do a demo on. I don't see it at the moment, but and it's an at-home finger stick test. So you do got to get like a little bit of a blood sample on that. Okay, what else? What else? What else? Vitamin C supports endothelial function. Their heart attacks. I love vitamin C. I love eating vitamin C. I love lemons, limes. Avocado is very high in vitamin C. There's different, of course, fruit is high in vitamin C, so I like that as well. What else? If one has atherosclerosis, stent put in January 2020 on Plavix. Now, I don't know why you're still on Plavix. I would definitely work to get you off of that ASAP. Check out my product flow, FLOW. Still can't get down my LDL. You know, you may want to look into this Malacca 1943. You may want to look into Mel-Lock. You may want to look into Optilipid. Yeah, George Ramos, peroxides. Peroxides is a big one. Doc, you don't vouch much for supplementation, only from food. I prefer food. I prefer food first. Magic 60, flats 99. I have coronary disease, 4 stunts. Now they want my LDL under 60. I get it. I mean, I get that they want that. They want to lower your number down as low as possible and then hope for the best. Here's what happened. When people, this was from the Repatha study, and Repatha and statin drugs, they got levels down to 30. The problem is more people died than the group on the statin drug alone. I don't like the idea of driving the numbers down. I think it's a major, major problem. False sense of security. You could definitely do better. Yes, we definitely need omega-6s. We need omega-9s, olive oil. When you eat fish, you're getting omega-3, 6, 9. It's all in there. So it's not just a straight omega-3 product. It's a full spectrum. That's why I like eating seafood and I don't like taking fish oil anymore. I used to recommend fish oil and now I don't. One thing you may want to look for, maybe my team can put this in there, is the wild salmon roe, naturalheartdoctor.com/wild-salmon-ROE. My cholesterol is 286, my triglycerides, yada, yada, LPA, LP little a, do I need to be concerned? Yeah, so what we want to do is we want to make sure we get down that LP little a. We can do so naturally. We can do so with time-release niacin. Garlic's pretty good here. Optilipid's pretty good here. All of our methodologies help to reduce the number down. But I think the other thing is that if we're really concerned, we can also take a natural fibrinolytic called Flow, F-L-O-W. So a lot of times we use time-release niacin, Optilipid, and Flow for people like that, emu oil. There's a lot of different things that we could do. It's not a death sentence. There is actually some value to it, which is why 10 to 15% of the population has significantly elevated LP little a. Yeah, again, we're not looking, I'm not talking about Viva Naturals or any other source of EPA, DHA. I'm talking about eating seafood. Eat seafood. Great questions, people. We got a lot going on. Go ahead and top chat any other questions that are in there. Now is your time to speak to a board-certified cardiologist. Previously board certified. I am a cardiologist. Previously with a fellow of the American College of Cardiology. Feel free to jump in there, people. So again, if you like this presentation, give me a thumbs up. If you want to hear more presentations like this, I will be going live every Wednesday, same time, different topics. Email us in the comment section here. Feel free to ask for future topics. That's fine. We are across the social media spectrum as far as we are on Instagram, Facebook. We've got a Natural Heart Doctor page and a favorite or a private community, 100-Year Heart Community. And then we have YouTube. So again, share this information. Sharing is caring. Sharing is caring. This holiday season, why not give someone a subscription for Cardiology Coffee? That way, every time that they drink their coffee, they're thinking about you and what a generous gift it was for you to buy them a bag or two of coffee on a prescription and subscription basis. It's better than a sweater. Every time they drink their heart-healthy coffee. So there you go. How many times do you eat seafood in a week? Usually 4 to 5. Don't worry about mercury in the small fish, sardines, anchovies, etc. I like cayenne pepper. I don't know how necessarily heart healthy it is. Probably pretty good. The human heart 143. The wrench. Loves Cardiology coffee is my favorite. Tastes so good. Thank you so much. It is very, very, very tasty. Mel Locke, 1943, had angina in 2022. After the stent, taken off the Plavix, got yelled at by my cardiologist. I've heard that before. Which test did I buy? A lot of different things we can help you with, Mel Locke. But again, you may want to look into that oxidative stress test and just get you buy the test and then you get a review with one of our practitioners and we'll give you some good next steps. So, Acetosterolemia, and then a future podcast. Good. Sardines, mackerel. I love all those things for sure. Cardiology gift card. That is in there as well. You can give somebody a gift card. So thank you for my team for posting that. Why not just buy a subscription? Just fill out the subscription, somebody else's address, and then now they're on a subscription. I guess maybe that's in perpetuity, so that maybe they're tough. Like, what if it's, you're buying them coffee for the next 5 years? Maybe you want to buy that person coffee for 5 years. I don't know. Heartattackristest.com. Thanks, Doc. Looking strong, by the way. Looking strong. I'm feeling strong this morning. As I'm looking, though, I'm like, my hair is a little bit, my hair needs a little bit of a tightening, I guess. Should I really be worried about my hair, people? Should I really be worried about my hair? Probably not. My hair is no longer my best quality. It used to be one of my good qualities. I used to have dark curly hair, like my 18-year-old son. Now I don't. Over 3,000 people are here, and I'm talking about my hair. Ask questions. Please comment on familial hyperlipidemia. Familial hyperlipidemia or hypercholesterolemia affects 1 out of 250 people. Those are the people with total cholesterol above 400. So if that's not you, then you don't have familial hyperlipidemia. Even if you do have total cholesterol above 400, I prefer natural treatment strategies because I don't prescribe statin drugs. I have not prescribed a statin drug in over 10 years. I have never prescribed an injectable statin, or excuse me, an injectable cholesterol lowering drug like Repatha, for example. So that is my commentary on familial hypercholesterolemia, because you can lower numbers down, but it doesn't fix the gene problem. Because what happens is that it's not that the liver is making too much cholesterol. It's that there's a problem with the ApoB lipoprotein on the LDL, so it doesn't dock with the LDL receptor, and they don't meet. There's a lot of different things that can cause problem between the LDL particle and the receptor on the liver, a lot of different things there. But that LDL particle, it also isn't getting into your other cells that need LDL in there. So that's where sickness happens. That's why those people die. So what we need to do is upgrade the entire system, not just lower the number down. Does that make sense? Because LDL serves a purpose. LDL is the bus that drives fat-soluble vitamins, A, D, E, K, drives CoQ10 around the body. LDL is an antioxidant, anti-inflammatory, part of our immune system. And it's supposed to go into the tissues and clear things out. But if it can't get into the tissues and clear things out because of some kind of a genetic SNP, if it can't get into the cleaning process, yeah, you're going to be at higher risk. So we really need to be diligent about doing all the other things to lower your risk. Is there a test for determining if aspirin is warranted? Aspirin is not warranted. You don't have an aspirin deficiency. I don't think it's good. High LDL, high LP little a, and having pain in the heart. Well, I would probably get that checked out. They want me to have a nuclear stress test and statins. You say no. Well, first of all, if you don't want to do a nuclear stress test because you don't want nuclear material injected into your body, imagine that, right? I wouldn't want that. If you don't want nuclear material injected into your body, what you want to do is you can ask for just a plain treadmill stress test, or you can ask for a stress echocardiogram, which is either you on the treadmill or a pharmaceutical to increase your heart rate, and then they can use ultrasound to see your heart. That's all that they really need, and that's of course all done with EKG monitoring as well. So But if you're having classic pain, if you're having angina, if you are walking up a flight of stairs and your chest hurts, you don't need a stress test. You need to go for an angiogram, and then you'll have a stent or maybe bypass surgery for the symptoms. If you don't want to have stent or bypass surgery and you don't want to have an angiogram, then let's help you with your symptoms naturally and see how we can do. Now, there's also pharmaceuticals like nitroglycerin. There's pharmaceuticals that can be used that can be helpful. Best recommendations for familial hypercholesterolemia: follow the 100-year heart method and take my masterclass. And do everything in the masterclass that I recommend. That's my best recommendation for everyone here, including those with familial hypercholesterolemia. Does that make sense? Good. Good. Thank you, George. Much respect. You haven't given a statin. Well, why would I give it? I wouldn't want to take a statin. Why would I give it to somebody else? I don't. Is it okay to take nattocerazime instead of blood thinners, and how to get rid of AFib? I can't take the medication. Again, I don't want to tell you one thing or another, but I will tell you that we do have people that are on our product called Flow, that also helps with plaque reversal. So, what do you think of the thrombogenic hypothesis? Well, thrombogenic hypothesis, I'm not familiar with that particular hypothesis. Yes, people can have higher likelihood of thrombogenesis, or the creation of thrombus or clot, in various places in their body. So yes, there is a lot of that going around. How do you decrease your thrombogenic potential? You follow the 100-year heart method: Thrival nutrition, lifestyle, Thrival mindset, Thrival biohacking, Thrival ultra diagnostics. Instead of nattokinase, I recommend our product Flow, which is nattokinase and serrapeptase, 1 cap 2 times per day away from food. I don't like chelation for removing plaque. Chelation doesn't work. It's expensive. It's time consuming. And again, it doesn't work. That's been proven. If it worked, I would do it in my office. And we don't do it in my office because it doesn't work. Because I'm that kind of guy. Because I don't do things that don't work. And it's been proven not to work. Now, there are natural ways to get the garbage out of the body. There's ways to improve your detoxification system. Sauna is one of those things. Here in the office, we actually have people in today doing tissue plasma exchange, which is like a dialysis to clear out old gunk, old dead cells, old proteins that are no longer being used, that the body's struggling to clear, microplastics, the spike protein, other inflammatory particles that are known to be linked to cognitive disorders and dementia. Tissue plasma exchange clears that out. Dr. Keith Smeagol does that in our office here as our kind of anti-aging specialist. Meloc, the Flow product, is okay if you're on Plavix. Yeah, you want to be careful. And there you go. Julie Miller's in the house, quoting the book of John and Corinthians. I'm not sure if that's really applicable to the conversation. I love the Bible quotes, obviously. So no one comes to the Father except through me. No, I agree with that. Good morning, Doc. How do you have an opinion on how to end blood thinners after hip replacement and yada, 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 yada. That's kind of a lot of things that are going on in this particular person, but yeah, we can definitely help. How can I improve my glycocalyx? Suzanne, everything we do helps the glycocalyx. Everything we do helps everything we do. So the answer there is definitively yes. One thing in particular, glycocalyx, is the arterosyl, arterosyl. Maybe my team can put that in there. Arterosyl is specifically designed to support the glycocalyx. What else is good for the glycocalyx? Seafood and sunshine. Seafood, sunshine, and sleep. Yes, I do like red light therapy. I do. Okay. All right. Well, listen, we got a lot of people still on the call here. I appreciate everybody here. Again, give me a thumbs up if you like this. Come on, people, give me a thumbs up. I'm working hard here, going rapid fire in the Q&A, preparing the presentations. Give me some thumbs up. Give me some love here coming up. And when we're done with this, just grab your copy of it and share it. Also, team, can you put in a link to our newsletter here? We send out a weekly newsletter, so make sure you're on our email list. If you're not, make sure you are. So go ahead and give me the link to join, to get onto our newsletter. I can probably find it myself here if the team give me a second here. Contact us, join our email list. This is subscribe. So what that is there, we got that, and we got that. Okay, cool. Yeah, so give me some more thumbs up. Come on, give me some more love, people. I just want to know if you know where the button is on there. It seems pretty simple to find it. Let's see here. Because I'm just like upset because I've only got 45 likes. There's over 2,000 people here and 45 likes. That's like not a good percentage of likes. That's like 2%. That's not really good. So that means 98%, right? Because we're all statisticians now inside of the medical world. 98% of people are not giving me a thumbs up. 98%. So anyways, I want to thank my awesome team who's here and monitoring. Much appreciated on here. About Flow, I'm a friend of Kevin's, and I comment daily, and I share also and send daily prayer. Love you. Love you too, Daniel. Thank you so much. I appreciate the prayers. We all do. I pray for you. I pray for you all. Thank you, Almighty Heavenly Father, for giving me this information to be able to share with the world. Give me the wisdom and the strength to continue to do so. Protect me and my family and all of us who are speaking the truth about how to stay healthy and well in the image of you. Our ancestors at the time of Yeshua lived a healthy life, living outdoors, quality sleep, just no exposure to all the toxins that we are today. Return us to that glorious time of health and wellness and longevity. I know that some of our ancestors lived for hundreds of years and they lived productively and lived well. And I, again, thank you for giving me this wisdom. And thank you for having everyone here to listen to this message. In Yeshua's name we pray. Thank you. Yeah, so YouTube, anywho, there we go. That's like the first time I've ever prayed, actually. Thank you. Christina says, thank you for the beautiful prayer. How about that? See? God is good. Come on, people. He's helping us for free. Give him some love. All right. It's not a big deal. It's not a big deal with the thumbs up and stuff like that. I'll live. It's not an ego thing. I wonder, though, if you... yeah, I mean, I think people are mentioning I had 3C jabs. Do you think that's affected my heart? Yeah, I do. I definitely do. I have been on the side of not injecting yourself or your child with chemicals since 2005, since I woke up to the truth. And all we have to do is think maybe about the most recent rhetoric going on right now about should we inject children, newborn babies, for hepatitis B, which is a virus that allegedly comes from IV drugs and sleeping with prostitutes, which is not any newborn babies that I know of. So I think if they're willing to do that, they're willing to do anything. And I think you should question it. And if that industry and the doctors, the MDs are willing to do that, then does it make you question statin drugs? Does it make you question everything in healthcare? And to say that it's about the almighty dollar. Now, you may look at me and say, oh, well, Wolfson, you're making money doing this. Like, you're not really doing this for free, right? There's some kind of a back angle here. You're trying to sell this masterclass. You're trying to sell this cholesterol product, Optilipid. You're trying to sell the heart attack risk test. trying to sell all this stuff. I'm proud about selling this stuff because I'm selling health. I used to sell sickness with nuclear stress tests and other unnecessary procedures. I used to sell a lot of follow up visits to refill the statin drugs and the blood pressure drugs. I was selling sickness, and I'm not proud of that. But I'm honest about it. I am proud about the fact that we are selling the best heart health information in the world. A lot of it's free. We are selling the best heart health tests in the world. Some of it's bigger investment, some of it's little investment. We are selling the masterclass and information, and we are selling supplements. We are. And I'm proud about our supplements. Like my product, Kickstart My Heart, unvaccinated bison liver, heart, kidney, from prairie grass-fed, field harvested, shot in the field animals. There's no better product in the world. My buddy Saladino, very inferior. My buddy Liver King, very inferior. Very inferior products. My product is much more expensive. It's up to you. I'm not forcing you. I'm not forcing you to take it. Ozone blood treatment. My guy Keith Smeagol here, he's doing that right now on a patient, so I do like that. Yeah, Priscilla, God bless you and yours. Thank you so much. George, God bless you. 2 MIs in 7 years. Recently said no red meat. Woo, bad choice there. Red meat. Red meat's the problem. Tell that to the lions and tigers, right? MFATs 2322. Don't feel defeated. Continue to find the root cause. Continue to find the root cause. There's a lot of other factors. Okay. So, all right, you guys are awesome. I've droned on long enough. Come back with questions next Wednesday. Tell your friends about next Wednesday. Share it for next Wednesday. And I will see you all next Wednesday.